Had an ectopic, I'm going to talk about what trying to conceive looks like after having an ectopic pregnancy. An ectopic pregnancy is when a fertilized egg grows outside of the uterus. 90% of ectopic pregnancies are within the fallopian tube. As that pregnancy grows, it can cause that fallopian tube to burst or rupture, and this will lead to some major internal bleeding. This is why a ruptured ectopic pregnancy is a life-threatening emergency. What are some of the risk factors? Having had a previous ectopic, previous tubal surgery, pelvic inflammatory disease, or PID, endometriosis, history of certain sexually transmitted infections, history of previous pelvic surgery or abdominal surgery, and then others such as smoking, being over the age of 35, undergoing IVF or artificial reproductive technologies, and a history of infertility. How do we diagnose it? With a pelvic exam, ultrasound, and monitoring HCG levels. What are the symptoms? It can sometimes get tricky because some of the symptoms of an ectopic pregnancy are very similar to symptoms of early pregnancy. Whenever in doubt, please talk to your provider. But symptoms would be abdominal pain, abnormal vaginal bleeding, cramping, lower back pain, sudden severe pain in the abdomen or pelvis, fainting, and dizziness. What's the treatment? Typically, we have two options here: medication or surgery. Medication we can use to treat is called methotrexate. Not everyone is a good candidate for methotrexate, so make sure you have the discussion with your provider. And in certain cases, surgery is going to be the best option. In a life-threatening emergency, it's definitely surgery. That surgery typically looks like a salpingectomy where we remove the fallopian tube. But depending on the location of the ectopic, it may be different for you. The doctor will let you know where your ectopic pregnancy is located and then go from there as far as surgical management. If you've had an ectopic, when can you get pregnant again, and when is it safe to start trying to conceive? The recommendation is to wait at least 3 months or 2 regular menstrual cycles. Remember that bleeding within the first week of having your ectopic pregnancy is not your period. This bleeding is a response of the falling hormones that we see with an ectopic pregnancy, which causes you to bleed. It is not a normal period. You'd want to wait 2 period cycles after that. This allows your body time to heal and recover from the ectopic pregnancy. And it decreases your chance of having another ectopic. Essentially, it's allowing for the inflammation to heal. And honestly, I think waiting this time also gives you time to heal emotionally and mentally. You need to give yourself time to grieve and process this loss. Make sure to always reach out to your OBGYN for the best recommendations for you. All right, thanks for watching, and I'll see you in the next video. Bye.